S1 is produced when the mitral valves are getting closed. S2 is produced, mitral and tricuspid. S2 is produced when the aortic and the pulmonary valves are getting closed. Okay, so S1, S2. Just remember, this has been a question that S3 and S4 are diastolic sounds. Okay, S3 and S4 are diastolic sounds. It happens because of what? See, S3 is happening because of rapid filling. During the rapid filling phase, see, if ventricle is this is the ventricle, this is the atria. If the ventricle is partially filled, okay, partially filled, with that, if atrium is contracting rapidly, okay, see, here there will be blood, okay, here there will be some amount of blood and atrium is now contracting. So because of this rapid filling, during that, if there is a volume overload, okay, volume overload, hope I am clear with these terms. If not, then we are in trouble. See, this is the ventricle, this is the mitral valve, and you know all that if there is a condition known as volume overload, for example, there is aortic regurg, so every time there will be heart will be almost very much filled, okay, almost heart is very much filled. If there was a normal person, heart would have been filled just this much, okay. So now in overfilled heart, okay, this overfilled heart, this much amount of blood is already left inside the ventricle even after the systole, now the heart is relaxing and the blood is coming from where to where? From, this is the atrium, let me draw the atrium, this is the atrium. So this direction the fluid has to flow, this direction the blood has to flow. So compared to this one, this is normal and this is the volume overload. In the volume over condition, the heart is already too much filled with blood, and in this completely filled with blood heart, if I put more blood, that is because of rapid filling by atrial contraction, the sound that is produced is S3. Okay, now S4 is very easy. This is volume overload. Please remember, I have written over here volume overload. Now for the S4, this was S3. Now for the S4, if atrium, same this atrium diastole, atrium is getting this thing, and during that period, if this is happening against the thickened or hardened ventricle. Now, for example, this was the normal heart. Again, I will draw one more heart. That is the over here. This is my again abnormal heart. It is too much thick because of hypertrophy or because of anything restrictive cardiomyopathy or anything infiltration of heart myocytes and all. Okay, if it is too much thickened, okay. So what is going to happen in a normal language, if in layman language, if I tell you, there are two types of bucket. In olden days, in village areas and all, they still use that stainless steel bucket. Okay, that is very thick and hard. And nowadays we are using plastic buckets. Okay, now in both, if you turn on the tap with same intensity, what is going to happen? Which is going to make more sound, the plastic bucket or the old purana, that metal bucket? Definitely the steel bucket will make more sound, okay, because it is hardened and thickened compared to the plastic. So same like that, ventricle that is thickened and hardened because of what? Because of, please remember, pressure overload. I'll write here pressure overload. So because of pressure overload, whenever there is thickening or hardening of the cardiac wall, ventricular wall, and then when heart contracts, when the blood is getting filled inside that will produce more sound, that is abnormal sound, that is S4 sound.